A new treatment for inflammatory bowel disease could be on the horizon. An Australian scientist who's identified a bacteria linked to the condition is now turning his research to the development of a treatment for the debilitating disease.
Every 8 weeks, Marissa Coniglione returns to hospital to get an intravenous infusion of drugs to keep the symptoms of her ulcerative colitis at bay. It's a disease she's lived with since she was 11 years old, and despite her bubbly, optimistic outlook, she says it's taken a toll.
I couldn't study what I wanted to do because I wasn't at school enough from my time off. I can't travel as much as I want to because it's always in the back of your mind if I'm going to get sick or a flare-up.
She was hospitalised for a month in high school. Her biggest fear now is one day the drugs will stop working and she'll face the prospect of having her bowel removed.
One of my biggest fears, every time I get a bit of tummy pain, it just comes to the front of my mind.
The disease causes inflammation and ulcers in the large intestine, leading to severe pain and bloody diarrhoea. And like the other most common inflammatory bowel disease, Crohn's, it's a life-changing diagnosis.
Many patients that I look after are affected when they're growing and developing. It can affect their puberty, affect their education and potentially their future career prospects. And it's increasing all around the world for reasons that we don't fully understand.
He says the current treatments like steroids and drugs that target the immune system can have side effects and lose effect over time. It's the long-term solution that Dr. Samuel Forster is trying to develop, using microbiome-based medicine that, in layman's terms, uses good bacteria to fight the bad in the bowel.
It's just like picking up bacteria as you would in your daily life, but we're controlling which bacteria you're receiving.
Inflammatory bowel disease affects about 130,000 Australians. It's incurable and we still don't know what causes it. Researchers hope that by identifying the bacteria behind the symptoms, a safe and effective treatment for the disease can be developed.
What we're trying to do is say, actually, there's a specific bacterial composition that will be beneficial for this particular group of patients.
So patients like Marissa can live life to the fullest.
I'm super excited that one day IBD will be something that I don't have to think about.
Abby Dinham, SBS World News.